If you have peripheral neuropathy, you probably heard a lot about blood sugar, and for good reason. High blood sugar is one of the best established metabolic factors associated with peripheral nerve damage. But there's a bigger question researchers are starting to ask. What if your nerves don't care only about your blood sugar? What if they're responding to your entire metabolic environment? This means your blood sugar, but also your waistline, your triglycerides, your HDL, your blood pressure. And what happens when several of these problems start stacking up at the same time? A 2025 study looked at more than 1,100 people with peripheral neuropathy. Instead of just asking whether someone had diabetes, the researchers looked at something called metabolic syndrome burden. That basically means how many metabolic problems does this person have? They looked at things like abnormal glucose regulation, excess body weight, high triglycerides, low HDL, and high blood pressure. And they found something very interesting. As the number of metabolic problems increased, neuropathic pain became more common. After adjustment, each additional metabolic syndrome component was associated with about a 23% higher odds of neuropathic pain. Now, I want to be really careful about that number. It doesn't mean that every metabolic problem makes your nerve damage 23% worse, and it doesn't prove that metabolic syndrome caused the neuropathy. This was an observational study, but it does suggest something very important. The total metabolic environment may matter, and this wasn't the only study to find something like this. The Rotterdam Study looked at more than 1,200 older adults. People with metabolic syndrome had almost twice the odds of polyneuropathy, and two findings really stood out. People with an elevated waist circumference had about 2.8 times the odds of polyneuropathy. People with elevated triglycerides had about twice the odds. And importantly, the researchers reported that the relationship was present even when diabetes was taken into account. They also found that reduced nerve function in some people who did not yet have obvious clinical polyneuropathy. So this raises the possibility that metabolic stress on the nerves may begin before somebody develops the classic picture of diabetic neuropathy. Another large study called the Health ABC study followed more than 2,300 older adults. Again, neuropathy became more common as the number of metabolic syndrome components increased. And then there was the Maastricht Study. This study included more than 2,400 adults and looked at several different measures of nerve function. They also found a pattern where increasing metabolic burden was associated with worse nerve function measures and neuropathic pain. But there's an important detail here. Blood sugar still mattered a lot. In fact, in the Maastricht Study, abnormal glucose regulation was the most consistent metabolic predictor of impaired nerve function. So I don't want the message of this video to be blood sugar doesn't matter. It absolutely does. The better message is blood sugar may be one part and possibly the most important part of a much larger metabolic picture. And there's another study that makes this even more important. It's called the PROMISE Study. Researchers followed people who were at high risk for type 2 diabetes. They found neuropathy in about 29% of people with normal glucose regulation. That increased to about 49% in people with pre-diabetes, and it was about 50% in people with newly diagnosed diabetes. But after the researchers accounted for glucose status, metabolic syndrome itself was no longer independently associated with neuropathy. Pre-diabetes was. So the research isn't completely unanimous. Some studies suggest that metabolic syndrome contributes to neuropathy beyond blood sugar. Other studies suggest that abnormal glucose regulation explains much of that relationship. That's why I would never tell somebody that high triglycerides, obesity, or blood pressure automatically cause their neuropathy. The science just doesn't support that conclusion yet. But one factor keeps showing up in several different studies: body fat, especially central obesity. In multiple studies, waist circumference or body weight remained associated with neuropathy even after researchers accounted for their blood sugar. There are also studies showing measurable neuropathy in people with obesity who still had normal glucose levels. Again, that doesn't prove obesity directly caused their nerve damage, but it does raise an important question. What is happening to the nerve metabolically before diabetes ever develops? Obesity and insulin resistance can be associated with oxidative stress, abnormal fat metabolism, inflammation, and vascular dysfunction. All of those are biologically plausible ways that nerves could be affected, but plausible is not the same thing as proven. So what should somebody with neuropathy actually do with this information? I think the first takeaway is simple. Don't reduce your entire metabolic evaluation to A1C. A1C is extremely useful, but it may not tell you the whole story. I would also want to know what is happening with your triglycerides, your HDL, your blood pressure, your body composition, and your waist circumference, and whether glucose regulation is beginning to deteriorate even if you have not been diagnosed with diabetes. And then there's the next question. If metabolic dysfunction is contributing to nerve problems, can improving metabolic health actually help the nerve? The answer is very interesting, but we have to be cautious. One small study followed 32 people who had impaired glucose tolerance and neuropathy. They went through a year of diet and exercise counseling. Researchers actually used skin biopsies to measure small nerve fibers. And after a year, they found improvement in one measure of nerve fiber density. That improvement was also associated with less neuropathic pain and better sensory nerve function. That's very encouraging, but the study was small and there wasn't a control group. So I wouldn't say that this proves diet and exercise regenerates nerves. Another study followed people with severe obesity through a structured weight loss program. Their metabolic health improved. Their nerve fiber density did not dramatically increase, but it did remain stable rather than continuing to decline, and their neuropathy symptoms improved. So the evidence may be telling us something more nuanced than just lose weight and your nerves may grow back. It may be that improving the metabolic environment can help symptoms and may help stabilize some forms of nerve injury. Whether it produces meaningful nerve regeneration is still an open question. And I think that's the bigger lesson from all of this research. For years, we've tended to think about metabolic neuropathy mainly through the lens of diabetes. And diabetes absolutely matters. Blood sugar absolutely matters here. But there is growing evidence that we should widen this lens if somebody has increasing abdominal obesity, rising triglycerides, worsening insulin resistance, high blood pressure, and deteriorating glucose regulation. Those problems may be stacking together long before somebody finally receives a diagnosis of diabetes. And the peripheral nerves may be one of those tissues exposed to that metabolic environment. So if you're experiencing burning, tingling, numbness, or other possible neuropathy symptoms, I wouldn't look at just one laboratory number and assume the metabolic story is finished. Look at the entire picture and remember that neuropathy has many causes that have nothing to do with metabolic disease. Persistent nerve symptoms deserve an appropriate evaluation rather than assuming they are caused by diabetes or metabolic syndrome. If you want to understand the pattern of your own nerve symptoms, I have a free nerve health risk assessment that walks you through some of the major features that can help organize the next questions to ask. I put the link below in this video.